1 second.
Yeah.
Can you start? Sorry.
Yeah. So, good evening, good morning, and good afternoon. We all have, gathered over here on this virtual platform. I'm sorry, my cat. Oh, sorry. So sorry. We we have just gathered here, and today we are having doing a podcast, and it is on a very relevant topic, and it looks like that in yesteryears we were never talking about on these things such as social accountability. But as you know that we are moving, we see that lot of things have really changed, and the things which we used to value and the way we used to look at things and deliver things, there's been a major shift. So it's a good way of trying to talk about those things which we think that along the line we have missed out on some of the things. So it's a great idea. And when this topic was chosen, what we thought that, yeah, it's going to give us a new insight and a way to think and carry it forward. So, as you all know, that today's topic is social accountability, challenges and solutions for implementation. And today we have with us Professor Nirmala Rege, Madam, who is with us from IRA's Medical College. She's a professor in the Department of Pharmacology, and she's a hardcore uh, person who has been a medical educationist and one of my teachers. And we have Professor, Dr. Nirmala Rege is the host, and Professor Sucheta Dandekar, who is also a professor of biochemistry at IRA's Lucknow Medical College, is the guest today, who will give insights into the varied realms of social accountability. So, as we delve into today's discussion, we shall explore how educational institutions are reshaping their curricula to prepare future healthcare providers who are not only clinically competent but also socially conscious and community oriented, ensuring that the next generation of health professionals are equipped to serve diverse populations and address pressing health challenges in their communities. So, over to you, my dear friends. Thank you.
Thank you.
Dr. Nirmala, you are muted.
Yeah, we cannot hear you, Dr. Nirmala.
Yeah. Can you hear me now?
Yeah,
Yes,
yeah,
yes.
yeah.
Yeah. So I repeat again. Thank you, Dr. Farzana, for the kind introduction. I welcome Dr. Sucheta. I'm sure that audience here knows her very well. She's an integral part of all faculty development programs at IRA's Lucknow Medical College and IRA University. And she is a coordinator of IRA's CU certificate course and postgraduate diploma program in health professions education. Regarding today's topic, I would like to inform the gathering here that social accountability was her topic for dissertation for MHP, and she has written papers and chapters on social accountability. With this, we will start now. And uh, Sucheta, I have heard about social accountability, mainly in the context of government organization or civic organization, telling us about obligation of public servants towards the citizens' demands or requests. But I feel that the definition vary as per the different context. So, what is exactly meant by social accountability when we talk about health professions education?
Thank you, Nima, for that question. Social accountability in health professions education refers, uh, sorry,
Social accountability in health professions education refers to the obligation of medical schools and health institutions to direct their education, research, and service activities towards addressing the priority health concerns of the communities they serve. It's about ensuring that the healthcare system is responsive to the society's current and future needs. Actually, this concept was put forward by the WHO in 1995. And to make this entire concept viable, we need to remember Charles Bullen and Bob Woolard's partnership pentagram, which involves policymakers, health administrators, health professionals, academic institutions, and communities. These five people, he said, are so important, and they should be all brought on the same page. And as Bob Bullard, in all his webinars that I have listened to, I mean, he's the guru of social accountability, if I may say so. He has always said and propagated that everyone should be together.
Oh,
You cannot have one meeting with a policymaker, then another meeting with the administrator, and then expect everyone to do to come together. You have to see that all of them are there together on one platform. Markham et al. In 2021 then proposed one more partnership pentagram plus. So it's called a PPP model, where they included so many other aspects.
oh,
So this is the take on social accountability so far.
okay. I say in the literature also, no, there are certain terminologies which are used like social responsibility, social responsiveness, social obligation. Are these all synonymous to social accountability, or there is some difference which we have to understand?
You're right, Nima. But most of these terms are used interchangeably. However, Bullen in 2016 put forward a social obligation scale, which moved from responsibility to responsiveness to accountability. And the responsibility is something that we put into our norms, like our health professional body say that this is what our students need to do. So in a way, it is a sort of a social responsibility because they're being taught to do a few things. When our students respond to, say, the floods or to the blood donation camps, or they respond to epidemics, and they go on their own and of their own account, called saying that this is what we want to do. That is the time when we will say that we have achieved a sort of a social responsibility. And when this whole thing gets ratified, and you come under an umbrella where someone else is also going to judge you to see whether you are accountable or not. We move into that third part, which is social accountability. And these are the principles, and all these principles teach you to reflect and to think for yourself. What is it that are we doing, and are we doing things right or not? So that is it.
So it is like a quality, like someone has to stand there. You have a quality rather than you saying it is having a quality.
Yes.
Okay.
Yes.
But why recently it has become so much as a buzzword, social accountability? Is it why it is so important in medical education nowadays?
Yes, yes, and
It has
for
to
that
be there.
matter, health professions education also. It is one, first of all, if I can think of it, it's the growing health inequities globally, you know. Then there is the recognition that perhaps, I'm using the word perhaps, I'm not saying it is so, the traditional medical education or the health profession education may not address the community needs completely.
Mhm.
One more aspect is we are now slowly trying to change and convert our focus on preventive and community based care. And that is what is making it more and more essential for us to be more and more socially accountable. And of course, there is the need for the health professions to understand and address the social determinants of health. There are economic stability, neighborhood and built in environment, healthcare access and quality. All
Okay.
these, I mean, there are about five that we have social determinants of health. So they can be addressed very well when we have social accountability, when we stand under the umbrella of the social accountability.
So it is not something new, but it has evolved over the time. That is what I feel from you, what you are discussing. So can you tell us that journey of how it has evolved over the years?
Yes, Nima, thank you for that question. Uh, in fact, when WHO put forward this social accountability theme in 1995,
So 1995.
correct. So it remained so for that time. It was only in 2001, between 2001 and 2005, the Training for Health Equity Network was established. It is called the NET. So people who are working on with social in the whole gamut of social accountability will realize and will have understood that the NET has been a very powerful source. And they had an increased oriented focus on medical education. And WHO at that time also emphasized the importance of the social determinants of health. Then in 2010, so you can imagine, it's been as if, five sort of
Years.
years. In 2010, the global consensus of social accountability of medical schools was established. And they sat together. In fact, the whole, many people all over the world came together. And these are the people who put in 10 strategic directions for the health professions education schools to move towards social accountability. And those 10 aspects came from anticipating society's health needs to supporting continuous quality improvement in service and research and education to defining the role of the society. So many, there were 10 strategies and they were very logically placed, So if you go through them and if you read them, you say, yes, if we were to go through all this, we would just naturally become socially accountable. And then the same year, there was this development of the CPU model, which is the compassion, conceptualization, production, and usability model, which many people all over the world are now using.
Oh,
And also that same year, we had the first international conference on social
oh,
accountability. Yes. And in 2012, you had the formation of the global consensus. You had, see what happened over the years, 1995 to about 2011, people were becoming conscious of social accountability. But there were no frameworks to evaluate. Anything that is put into action has to be evaluated. And that is what people realized. And they came up with the development of evaluation frameworks. The NET was one of the first to launch the NET's framework of social accountability. And then in 2015, all this became integrated with the United Nations Sustainable Development Goals. The
goals.
SDGs,
Oh,
the 17
so there is a
SDGs that we keep talking about, this became integrated into this whole concept. And WHO, of course, we'll talk about the SDGs a little more if we have the time, but I'm just talking about the evolvement now. So I'm telling you this, and then I think it was in 2017 that an updated framework was released by the NET, and 2020, the pandemic taught us so much about the highlights, and rapid adaptation of the education to community needs was that time became so relevant and so socially accountable. And later on in 2022, 23, 24, we saw to it that times change and climate change became integrated into the whole concept, along with health equity considerations, and of course, the expansion of the international networks. So all this happened and is still happening. So, the whole concept is still underway.
So it is a evolving type of thing, starting from 1995 till today, and it will evolve further also. But all these organizations and frameworks, I believe, have roots into those core values which have been stated by WHO. I remember somewhere I've read about those core values. So can you elaborate on those values and their practical implications?
You seem to have done your homework well, Nima.
I have to
That's true.
to ask you questions.
Yes, Nima. There are 4 core values that were set: quality, equity, relevance, and cost effectiveness. When we talk about quality, it is the degree to which best evidence practice are used in education and healthcare delivery. And it will involve, evidence-based methodology, regular curriculum, strong evaluation and feedback systems, and integration of the modern technology. Equity is so obvious, I mean, it has to address health needs which are are devoid of disparities, and promote fair access to healthcare. So this will reflect in the diverse student recruitment process, training in the undeserved areas, cultural competency education, and the programs addressing the social determinants of health, and focus on many vulnerable populations. Relevance, I don't have to talk about it. It has to be relevant to the community needs, as I've been always saying. And as far as cost effectiveness goes, it is the degree to which the resources are used efficiently to maximize the impact of the health outcomes, So there has to be an efficient resource use, and whether it is a public private partnership, whether it is any other place where the money is involved, people, and that is why Bullens and Bob Willard's pentagram keeps coming in front of me, my eyes, that all the 5 people who are so involved with all this have to be there present, so that the disbursement of all the money that is there is done effectively and goes into the right people at the right time. And that is so important. So these 4 values will, I think, hold us in very good stead if we were to, keep looking at them and thinking.
So this concept, for that matter, for the health professions, educators or institutions, is so close to their heart, I suppose, because we always look for the community, whatever the curricula we try to develop. But those institutions who have used social accountability, implemented, are there some successful examples? Because we need some shining stars over there who have put some efforts over there and shown that it is working. Because that is what we look forward whenever we are novice in this. So can you give some examples?
Yes, Nima. you would be surprised, but now we have many schools all over the world who have uh, taken upon themselves to be called as socially accountable schools. So they have changed the whole format, the curriculum has changed, everything has changed to say we are socially accountable schools. I mean, just as the curriculum change of CBME
So that
or
that becomes the base.
community-based uh, education, people, there are universities which will opt for this kind of education. There are now universities which have opted for socially accountable, to be socially accountable schools. And you'd be surprised. There is this North Ontario School of Medicine in Canada, which has decided, you would think that, I mean, in the beginning, before I really got into this whole business of social accountability, I would think that this is, related to Asia, Southeast Asia, where we have these rural and urban divide, and we should be thinking of social accountability. But it is so surprising that even people in Canada, in Australia, etc., are thinking about it. And the Northern Ontario School actually focused on rural and indigenous health, and they distributed the community-based learning model, and 94% of the graduates serve in the rural communities. And there is this integration of indigenous health practices.
So this is very important, isn't it? Like in India also we have indigenous practices, but we have not yet integrated with our in our curriculum. That
yes. So it's the point to think about. The Cicero University in South Africa, the Flinders University in Australia, which realized that this Aboriginal health programs can be brought under their university, and community engagement initiatives can be taken. They even have a longitudinal integrated clerkship program, which they are now using. But look at India also. I mean, because we are here, I'm talking about
India also.
in the India scenario. CMC Vellore, the Christian Medical College Vellore, they are the pioneer in community oriented programs, and they established rural services. And not only that, they have a 2-year service commitment for the graduates. So they don't, unless they do what they have to do in the rural areas, they are not allowed to graduate. Then Mahatma Gandhi Institute of Medical Sciences in Sevagram, Vardha, the social service camp. In fact, I remember when my daughter was going to apply, she also, for medicine, she also went for that entrance exam, and she had to write an essay which was very, very much bordering on the social accountable issues, and I was quite impressed. But that is so they take a commitment from the graduates right from the beginning that you should be committed to do the good and the mandatory rural postings, etc. And of course, there was the family adoption program that they introduced.
So we have that now also in our curriculum, isn't
so
it?
Now the National Medical Commission in India, they have now introduced the family adoption program, taking it up from
social accountability in the background. Correct. Or as a foundation.
Yes, yes.
But all these institutions, when they were trying to implement social accountability or making their curriculum more and more oriented towards it, they must have faced some challenges, isn't it? Or can you tell us major challenges?
First, most important thing that comes into my mind immediately is resistance. And always, any change, there will be resistance. So there will be, there has been a lot of resistance from the traditional curriculum models. Then there is difficulty in measuring the impact, balancing the community needs with the academic requirements. When I say this, see, not all the students who will be a part of this social accountable school per se want to continue in this direction. They may want to also go on ahead to do something else globally. What we need to do to strike the right balance
Okay.
between social accountability and seeing to it that their academic requirements are also fulfilled, so that we make them wise, not just as far as the social accountable thing is concerned, but also globally relevant. So maybe tweaking the curriculum is a necessity. I don't know, I may be wrong here, but that is what I personally feel. And engaging the stakeholders effectively. Sometimes what happens is everyone is there on the same page, and the policy maker will say, what is there?
That's why that pentagram or pentagram plus is important.
They will say, what is there in it for me? If that is the question asked,
It will fizzle out.
everything fizzles out. Also, there is this cultural and linguistic barriers, that are felt, and which we should take into account.
So that is so important. You said cultural and linguistic barriers. From India point of view, I'm looking at it for our country. So as you have given the examples from our country, did we face any unique problems related to India? And I'm saying India, but it could be any country which is so vast, or where there are diverse population, if there different cultures are
You said
existing.
it. You answered my question, Nima. Large population diversity, rural-urban divide, resource limitations, cultural and linguistic barriers, traditional healing practices, which need to be integrated, and socio-economic inequity. They are all parts which have, which are the challenges. But there have been some innovative solutions to these challenges, and that is what our
No, I was
podcast-
going to ask you the same thing.
That is
How
what-
these challenges are managed? There is a big list of challenges. So, can you, in nutshell, you can tell us?
So, first of all, I think uh, 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 people resorted to mobile health units. Health mobile vans were taken. Village health care workers were there, so it was properly modulated and used. Integration of Ayush, our traditional medicine, which Ayurveda.
So that is our Ayurveda, Unani, and Siddha, homeopathy.
Yes.
But we have their healthcare system and
Yes.
our department of Ayush now
Yes,
in
so
our
which
health
which
government.
includes Unani, it includes the homeopathy, includes Ayurveda. So all this has to be put into the system, because ultimately there will always be people who will believe in some small remedies as far as the traditional medicine is concerned. I mean, I know, we've seen this as we grew up also, right? Use of turmeric is so, first thing is.
And we have example of China before us. So, yeah.
Yes. So there, it is there. And public-private partnership, if it is used very judicially, will help. And there is so much of management know-how that the private people have, maybe which we as public organizations, do not have, which they can help us to take this entire concept forward. And so the implementation strategies would be this partnership, and the adoption programs, etc. And we need to have rural immersion programs, which will help.
It is very tempting for the administrators, I feel. It's very tempting for the administrators that they may like to go or implement social accountability, but we need some indicators or measures for that, because unless we know what is the progress in that direction, or how far we can go, whether we can go first of all in a direction or a right direction, how these indicators and tools have they been developed so that they can be guide to any person who wants to, or any institution who wants to implement it?
As in any project, I will think of a short-term indicator.
Like our favor project.
Yeah, middle term indicator and long-term indicator. In the case of short term, I would think of student engagement, community participation rate, stakeholder satisfaction surveys. Can have surveys to see how well we are doing, and learning outcome assessments. As far as the medium term indicator could be graduate career choices. If we make a good impact on our students, more and more students will want to go into the rural area and help. In fact, I have seen this, and I'm sure you have also seen this. And I have so many friends who are into practice, orthopedic practice, ophthalm practice, and as they make their money, so to say, and they become worldly wise, and they realize that there is so many people who are, wanting. I know of so many friends who have take one a weekend off every month and go into the area and serve people. So these are the people who are motivated.
I remember Dr. Shekhar Bhojrat, my batchmate, who is a world-renowned orthopedic spine surgeon. And he takes a few days off and holds camp in the rural area, in the tribal, to help the tribal community, because they can't come to Mumbai or to other places. And they, whatever the operations he does in these hospitals over here, he conducts over there, and that is at minimal cost to them. So people are trying.
Yes, yes. True, so true. And long-term impact will be, population health outcome, healthcare access improvements, health workforce distribution, and health equity indicators. And along with that, of course, there are many evaluation tools that are there. The NET framework, social accountability tool, social impact assessment, graduate tracking systems. So many are there now, which we can use in this arena.
So suppose an institution wants to embark on this journey of social accountability. What advice you would like to give to that institution? They have to start somewhere. So how to go about it?
I'm not, I mean, I know there are many more people in this world who are more adept to give advice. But now that we are part of this podcast, I don't say that I'm the authority to say this. But having read and worked on this topic for some time, I would say that beginning of a journey, beginning of any journey needs sustainability. So, and sustainability requires embedding the social accountability concept into the vision and mission roles of the university or the college or the system. And securing funding is important. Securing long-term funds, building strong community partnerships, developing faculty expertise, and of course, with all this, creating regular evaluation and adaptation of the programs is also so important. So the key recommendations would be to start with a thorough community need and assessment and involvement, focus on sustainable long-term this initiatives, and measure and evaluate the inputs. Remember that we can take global collaboration into consideration, take help from people who've already done it. Why not? And see to it that you have a leadership which will, which is looking in the same direction, so that it becomes viable. And we must have good assessment tools to measure the impact. Along with that, institutional support is so important. So these are all, to begin with, we need to do it. And to do all this, and I would like to bring to the notice to this audience that we have AME Guide 175, AME Guide 175, which is very, very recent. It got published in 2024. So it is just recent. And in fact, I went through this just before the webinar, before this podcast, I'll be very frank, and it has been very enlightening. And I got a lot of more insight because it talks about instilling social accountability issues into the whole environment that we live in.
So at the beginning only, you have to have a good plan, keeping all these factors which you have told in before you, isn't? You
Yes.
mentioned about COVID also, because after COVID there were certain changes occurred when we faced COVID, and some frameworks also emerged after that. In future also, we may address to these different predictable and unpredictable health challenges. Means, why not recently also we are thinking about that human metapneumovirus infection, which is we are seeing the cases. But there could be many more like that. So what role this social accountability is going to play in when we are addressing those future challenges?
First of all, the pandemic preparedness. I mean, we are already, now a little tuned, so we should remain geared up for that. Climate change, health impacts we have to look at, global health equity, then cross-border health issues will be a big thing now, because with so much of globalization and people moving from one part of the world to the other with such ease, look at the way our airports are, and how we don't even get a ticket, and if at all we're able to get a ticket, at what cost? It's because people are traveling here, there, everywhere. So universal health coverage and health workforce distribution has been the focus in 2024. But I would like to also bring your notice to the digital transformation, which will also be very relevant, and interdisciplinary approaches. Along with that, the sustainable development goals, the SDGs, the 17 SDGs that UN has given us for no poverty, no hunger, health, water, clean water, work and economic growth, all those have to be incorporated, I won't read out, I won't sort of talk about all 17. I can, whatever I can just remember immediately.
But
I'm saying
the thing, pandemic preparedness, you said, I remember that now we have pandemic the module, which is incorporated in our health professions education. So there could be a certain type of modules or making the students aware about faculty and students, and even the faculty development programs. They must be very important.
I tell you, nothing will work if faculty is not on the same page as what we are talking about.
Yeah. Thank you, Sucheta. Now we are almost at the end. So let me summarize what we have done so far, or whether I remember what you are telling us. First of all, social accountability in health professions education refers to the obligation of health professional schools to direct their activities, maybe it be education, it may be research or services, towards tackling the primary health needs of the community or the societies that they serve. You also mentioned about that these issues should be jointly dealt with by government, health professional schools, the healthcare system, health professionals, and the community itself that the institution is serving. We talked about the core values of the WHO, that is that quality, equity, relevance, and cost effectiveness, if I remember. And you mentioned about some key organizations, World Health Organization, WHO, that is 1995, the pioneer. But also the others also as well, which were very important, that training for health equity network, the NET. Then you mentioned about that global consensus for social accountability, AMI, Association for Medical Education in Europe, and network towards unity for health, that is tough.
AUFH is
sir.
really doing a lot of work around.
And you told us about notable frameworks and tools, WHO assessment framework. Then you mentioned about that CPU, and that C is that conceptualization, production, and usability. And also the NET also has got its assessment framework, isn't it?
Correct, correct. Along with that, we must remember, I forgot to mention, but now that you are summarizing this, I remembered there is Aspire Excellence in Social Accountability, which we should not forget. And there is the Game Changer Framework for Transformation, which also has now, people are using it a lot now. And two features of social accountability emerge, altruism and integration. Altruism focuses primarily on society's well-being, and integration is an integral part of the social canvas. So this is what we should also remember.
So all of us, we have to visit literature to read about these frameworks and decide which framework suits us or which one to select.
And if I may say so, just adding, from that Amy Guide 175, I just remembered, as we spoke, it didn't occur to me, but they emphasize promoting ethical awareness, including advocacy and policy training, and they do advocate faculty development. So for anything that we take, all these three are very important, and they have again highlighted it.
Okay. So thank you so much, Sucheta, for enlightening us on this essential yet challenging topic of social accountability. I'm saying challenging because it has multiple dimensions, and you have touched upon those in very lucid manner. May I request our listeners to reflect upon what they can do to promote social accountability in your own institutions or communities? And if anyone wants to share the experiences, or if you have time, you can please unmute and go ahead.
I think Shanta has one query in the chat box which says, what is the difference between social accountability and responsibility? I think I did mention that social responsibility is community oriented, whereas social accountability is contextualized. It is as per the needs of the social, of your milieu, of your environment. And that is the small difference between responsibility. But of course, there are many places where each one can be used interchangeably.
Nirmala, can I have my query comment?
Yes. Yeah, sir.
I'm Shahid Hassan from American University of Barbados, and thank you very much. We are a team, we work as a team, and I'm glad to hear excellent podcasts on social accountability by none but Sucheta and moderated by Nirmala. And thank you very much, team, and Prof. Farzana for opening the session. I am looking at it about the social accountability from the perspective of the competency-based medical education beyond the community-based medical education. So, and I'm looking at it where competency-based medical education is perceived to be inherently socially accountable. And do we have any opportunity, as an educator, I'm asking this question, with a paradigm shift to the competency-based medical education to change medical training to better meet the social accountability? Do we have that?
Very well said, Shahid. In fact, I have written a chapter on just this. How can we connect the dots between social accountability and the CBM? And I'll share that chapter with you. But
because when we say CBME, people always think about, when we say competency, people think of the community. I'm talking of the competency base.
Competency.
Yes, the competency, we can inculcate this entire concept into our competency. For the first thing that in India we have done is having the family adoption program, where children, our students right from first year are given the charge of a family, and they follow that same family throughout their career of 4.5 years in medical school. So that is the sort of the foundation to making them socially accountable, and it is a part of our competency based medical education. Along with that, we also have the ATCOM module, which is the attitude, communication
Ethics.
and ethics that is there. And
Mm.
this also talks about equity, health equity, and cultural disparity.
There
And
are
we
cases
do-
which are given
Yes.
in that model.
we have these cases which are very much related to this divide, and we make people think and ask questions on that, you know. So competency based medical education, if used and targeted in a very good way, and making it a part of our curriculum, in fact our questions also, in fact I insist, even as far as my even in biochemistry is concerned, I insist that the questions that are asked are also socially relevant. And if I give a case, if it's a 4 mark or a 5 mark question, my fifth question will always be, how will you counsel the family regarding this issue? So
Correct.
trying to make them think that it is not just the disease, it is, there are people around who need to know what has to be done and how it has to be tackled.
And another thing our government has done is that the course can be taught in the local language and translated, so that language barrier and communication not only with your patient but sending them into the communities, and they learn how to communicate, and that is always assessed by a third party.
True.
Yeah, and I'm happy that you have all the emphasis on contextualization in social accountability. On that note, can I consider competency-based medical education as a tool to measure social accountability relating to measurable outcomes? Can we? The competency-based medical education as a tool to measure
No,
the social outcomes?
I would beg to differ here. I
It's
would
a
not say
framework.
that it would be a tool, but it would be a conduit. It would be a means.
Okay.
If you can't use it as a framework to design, but you can, like as I said, no, you can use social accountability CBME to help us move towards social accountability.
Yeah,
In a
that's
very
right.
defined manner, in a very
Yeah, that's
defined
5
manner.
minutes. So
Thank you.
definitely, theoretically, competency-based medical education has got the potential to assess the social accountability.
Definitely,
And
Yes.
so this approach of curriculum, I think, is a move forward toward achieving fit to practice graduate in future. So that's what every institution would
And
like
I
to.
always feel
Very
that
much.
we should not wear blinkers, you know. Your
Uh-huh.
need and my need may be different. So you cannot have a general CBME under one umbrella. We have to contextualize it. We have to change
Yeah,
it
of course.
according to each
Yeah.
university's needs. So sometimes I feel, you know, I wish we were not put into such rigid framework, you know, with those boxes, just in the same as the boxes we are sitting in.
You are right. You're
I
right,
wish
because yeah,
things changed.
that era has gone where we were outcome-based education. Now competency-based medical education, which has strictly defined the competencies of the EPAs. So social accountability has got an opportunity hand in hand with curriculum and social accountability as a good move, and we think we are also looking at it in our American University of Barbados to practice this concept.
Very nice. Very
Yes,
nice.
very nice.
So Nima, I have a comment to make. I'm very impressed. Sucheta is a very important subject. And this is a subject that we discussed before. And I think 2 years ago, we had invited a famous professor, Sir Michael Marmot. Michael Marmot actually, he was given a task by the British government in 2015 to develop these parameters, which you mentioned in your talk. He worked with WHO and is the founding father of the NIH program in the UK. So Michael Marmot published 2 reports, and both reports cover all the aspects you mentioned. There are 10 points they've identified. Now, it is so
Yes.
important that we remember these things because these parameters, he actually compared north of England to south of England, which means in terms of quality of life,
The geographical divide.
yeah. I mean, this was about, like, for example, in Wales, people die very early because of even today, tuberculosis in the UK. So that was a famous report. And I thought this could be replicated and combined. Perhaps you could do a study across India and perhaps across Asia, looking at those parameters. Because when you talk about the quality of life, health, education, clean water, accessibility to health, all these parameters that Michael Marmot identified are, I think, they're so frequently available across Asia, India, Pakistan, Bangladesh, Nepal, and the Middle East countries. Recently, when I was in Iraq, I was talking to Habib, one of the professors in Kufa, that despite the funds they had, the oil, the poverty, and the lack of equality that is under education and health, these are the parameters we have to remember. One more thing I'd like to comment is that you mentioned that you're using this concept that you're assigning families to the students from first year to final year. What is the name of this program? Because the reason I ask, what is it called?
It's called Family Adoption Program.
Okay. The reason I raise this question is that this goes way back to 1979 or 80, when I had started forming the medical education department at Medical College, and a WHO professor came to tell us, he was Professor Bashir Hamad from the Sudan, he was the founder of the Suez Canal. He gave this concept, and the name of this program was Community Oriented Medical Education. It was financed by WHO. It was called COME. And I worked in different parts of Pakistan, different colleges. Of course, I was ridiculed all the time by my associates that why is it, how can you say? And it failed. And the reason it failed in Pakistan was because nobody wanted to send their girls, students, their daughters, to peripheral area to live with the families and look at them from day one. My question is, how does it work in India?
It's we have started the family adoption program about just a year ago. So its impact will have to be studied definitely. And how far, or whether the students are taking this as a compulsion, or whether the students are really getting moved to move in the right direction, time will tell. But I personally feel that just this exposure and being able to talk to the families and to find out their needs is important. At the same time, the families should not feel that they are being overburdened by them. There has to be a sort of a good via media. There are times when families get tired to see these students keep going on again and again to say, "Can we help? Can we help?" So
I
there is
think
a two-pronged sword,
I
where
think it might be worthwhile if you I'll try to find out. Lubna Beg, who's one of our CU's faculty, she was in charge. She actually published that paper, which might be useful for you, because she published this study from across different regions of Pakistan as to what were the reasons why it failed. It's a fantastic program because you send the child, you follow in good in health as well as sickness. And therefore, you have the whole profile. It's a brilliant idea. And I still feel it's a wonderful idea in terms of medical education. But I thought it might bring to your notice. And thank you so much for enlightening us yet again.
Thank you, sir. So I don't see any.
Thank you. Thank you,
Thank
Ma, Sucheta, and all the listeners who were with us today. Indeed, it was very enriching, and got to know so much about the concept in detail. Definitely, our this faculty family adoption program has started, and it is in the first year we are doing 10 visits, and the students, they go there in batches along with their teachers, and this kind of program is being run in India. Thank you so much, Dr. Nima, Dr. Sucheta. What a lucid way to discuss and make everyone enriching this experience. So, Dr. Zaidi?
Yes, ma'am.
Yes, sir. So, can we call it a day?
Well, Sakina is in charge. Over to Sakina.
Over to
Yes,
Sakina.
thank
Sakina.
you so much.
Thank you,
Yes,
Sakina.
Thank you,
thank you. It
Sakina.
was an amazing, very educational topic for me. And thank you so much, everyone, for joining. We'll see you again next week, next Saturday, for another
Thank you,
amazing
Sakina.
webinar.
Yes, do
Thank
join us for the
you.
next webinar.
Okay.
Thank you so much. Bye-bye.
Hafiz.
Thank you.
Bye-bye.
Bye.
Thank you all.